So what are the biggest advantages to having technology like HVNI or the precision flow equipment? I think they're very obvious, and the biggest thing is it's widely adaptable to all these patients that I'm caring for. So whether I have a very sick infant with a flu pneumonia or bronchiolitis, or if I have an elderly patient with the same, I can treat them kind of across the board with the same modality. This is a very well tolerated piece of equipment, and the Hi-VNI technology is immediately soothing to these patients. Their air hunger goes away, their work of breathing improves. Do I always use it in hypoxic patients, or do I rely, do I go to it when I see somebody with hypoxia? The answer is a lot of times I use it even if they require no oxygen at all. We see small children that have no oxygen requirement but have a tremendous work of breathing, and I'll start them on Hi-VNI technology right away. They respond really well to heat and humidity. They might even be on room air with that technology. The elderly patients respond similarly well. These folks also have comorbid conditions, and so their air hunger is going to immediately improve. Those folks don't tolerate the mask nearly as well as a younger person who you can kind of talk through it. And again, in children, we don't really use non-invasive positive pressure ventilation in them. So you can imagine a toddler trying to stuff a mask on them. It's just not going to work, especially if they're sick, they're a little irritated. You put a nasal cannula on with Hi-VNI technology, that heat and humidity, that turbulent flow through their upper airway is immediately soothing to them, and you can visibly see their work of breathing improve within the first few minutes.